Hi there. In this video, we're going to look at what you might do as a clinician when you get a task or appointment booked with you to see a patient about something that's come out from our pathology module. Now, the first thing you're going to need to do, certainly if it's come to you as a task, is use our pathology templates. So if you've not got it on your big buttons up here, it will be here. It's this kind of green graph with a red line. This will take you first to our pathology overview template, which has got kind of an overview of things that the system's picked up, and then some things from specific bloods. So let's go to the vitamin D page, and this will give me more detail. So at the top here, I can see what it is that's been flagged. So the latest vitamin D is below 25. Normally we'd be prescribing high dose vitamin D, but the patient is in some kind of exclusion. In this template on this view here, we're trying to give you the relevant information to help you assess this and see why this is triggered. So we can see the latest vitamin D is low. They've had some prescribed years ago, and we can see here the reason for the exclusion, so sarcoidosis. The information will vary a bit page to page, but it's always trying to be useful, clear, and give you what you need. If you think there's particular information missing, then do let us know and we'll review that. In terms of what you do next, every one of these pages, the top bit is the same. So we've got this outcome and it's split into two options. The first is to say that the review is complete. So all of them have got these two options. One is no further action and another is discuss with the patient. Some of them have other options like maximum tolerated treatment or referral options. Any of these will record in the system that this thing has been reviewed and no further action is needed. So it might be that I put no further action and then I've got to put in here some kind of notes. We've done some presets. Ideally, you might want to type something in, not appropriate for patient and no further action necessary. I don't know. Part of the reason for doing that is that whatever you put in here, the next time this is reviewed will appear on this side of the screen. So say a year later, the patient's had a vitamin D again, and you might have the same task again. You'll be able to see your notes and your reasoning, which might save a bit of time. That's one option. The other option is to say, no, they do need an appointment. And most of these have the same three options: a GP or clinician, depending on what terminology you might use, or AMP, a nurse practitioner, or a pharmacist. All three of these options would take them out of the list for a clinician to review, to sort of notes-based review. And these two options would put them in lists for the prompts and invites to arrange follow-up. And our systems would make it clear that that's the reason why the patient needs follow-up. Pharmacists would then get included with sort of med review, med discussion type invites. Once again, we've got a default answer because the idea is that the information is here anyway. But again, you could always put in more. And again, that information will then display here for whoever then sees the patient. Finally, there are other options. Again, this will depend a lot for different results. But it may be, I don't know, but it might be that actually you look at the exclusion and you think, no, that's fine, it's still appropriate to prescribe, for example. And so then using these buttons here will help you do those steps. So just to show you, if I click here, it's flagging that there are exclusions, but it might be, yeah, I've looked at it and it's appropriate. The exclusions don't necessarily mean it's inappropriate to prescribe. It's more a kind of needs careful consideration. This is not a bond or obvious, definitely safe to prescribe. Let's ignore that. That's flagging something else up. Let's pretend I proceed. And I think it will generate for me a preset message. So it's prescribed the medication in the background. Unfortunately, these things are a little bit slow when you do them from within a template. Where the actions are very common, you probably don't need to do as much review. They appear on the home screen. Again, let's get rid of that. So I'm prescribing high-dose vitamin D. Do I want to arrange calcium? Let's say I do. And there's a preset message that the system's generated to go with that explains that they've, you can see down here, look. We've done a prescription, it's been sent, and it's not to be taken every day, and so on and so forth. So you, the clinician, are the one who's making that decision, but we're trying to give you the tools and the information you need to make that straightforward as it can be. You can access all the other templates from along the top here. In time, you'll get used to them, but either these things here, or if it's kind of a definite action here, those will all take them out of list to review, mark it as complete, and document everything for you. Thanks.